A huge chunk of money is headed right here to North Carolina to help with an even bigger problem across our state. CVS and Walgreens have settled a lawsuit over how they handled prescriptions of controlled substances. Now, both companies say the settlement, it's not an admission of guilt, but together they will pay state and local governments across the country over $10 billion in damages. A sizable chunk of that money, $1.4 billion, is coming right here to North Carolina, according to Attorney General Josh Stein. He's one of the people behind the lawsuit that made the settlement happen.
We've been at this for 5 or 6 years now. The opioid crisis has been absolutely devastating to people in our state. Too many North Carolinians have died. Too many more are struggling with opioid addiction. And the investigation we commenced showed that the pharmaceutical industry played a role in sparking this crisis. So originally we went after some of the manufacturers for their false or deceptive advertising, went after the distributors for failing to sufficiently monitor where those pills got dumped into communities. And this last round of settlements has to be with the pharmacies themselves for failing to have adequate red flags to make sure that they weren't over dispensing these pills to certain people.
Stein says the money will be used much like other opioid settlements to help carry out North Carolina's Opioid and Substance Use Action Plan that increases community services and prevention efforts. Stein also stresses that the money is only part of the settlement.
We've also changed the business practices of the manufacturers. They can't advertise. The distributors, they have to monitor their distribution, and the pharmacies have to make sure that people aren't over dispensing. And because of that, we want to make sure it never happens again.
Every 5 minutes across America, someone dies because of an overdose. That's about 100,000 people a year. The director of the White House Office of National Drug Control Policy says the worst part is those deaths are largely preventable.
That we're looking at increasing access to the antidote when people are dying from opioids called naloxone or Narcan. It's critically important, and I'm so glad that from President Biden on down, we are all committed to ensuring this as a priority for the nation. So we make sure that naloxone, the antidote that can save lives, is available anywhere and everywhere.
One of the ways the White House is trying to help is by working with the FDA to change rules about Narcan. The agency said earlier this month it could approve an over-the-counter version that could be bought in stores without a prescription. But right now, anyone in the Triad can get a free dose. There's a vending machine at the entrance of the Forsyth County Detention Center. It's right there in the lobby, available every day from 8 to 8. So far, more than 700 kits have been taken from the machine. At least one of them has for sure saved someone's life.
Someone found a person who was determined to be having an overdose just a few blocks down the street from the jail. And they remembered hearing about that machine. And when they called 911, they actually told the 911 operator that they were going to run to the jail and get some Narcan out of that machine. By the time EMS got there, they were awake and they were doing okay. And it was thanks to the Narcan from that machine.
By the way, there is no interaction with the jail staff required to use the machine, and the jail does not keep records of who uses it. Program organizers say they picked that location because research showed it would be the most effective.
Did want to try and target people who are leaving the jail and people who are justice involved, as well as their family and friends. We based that off of a study that was done by UNC a few years ago that determined that people leaving incarceration settings were about 40 times more likely to have an overdose than the general population. And the most at-risk period was in the first 2 weeks after release. And so we wanted to put this somewhere where it would be easy to access for people leaving the jail, for their friends and family, and that kind of thing.
The Guilford County Health Department is also giving out free naloxone kits. Each kit comes with 2 doses. Just search the word naloxone on our website for more information. Doctors say this life-saving tool is not just for people who have an addiction. If you know someone who struggles, or even if you have a lot of people over to your house sometimes, it might be good to grab a free kit. In fact, health professionals want the medicine to become so commonplace, some are starting classes training people how to use it.
And insert it in her nostril, and then I would need to go ahead and push it.
Oh, okay.
That's it. Wow, yeah.
That's done. It's very easy.
Micah Sawyer is leading this training class for about a dozen people in Cotati.
There's such a stigma around addiction and about Narcan as well that people sort of hide and they keep it under the ground and they don't want to know about it.
Micah learned about Narcan, a medication used to reverse an opioid overdose, when his son, Micah Jr., became addicted to heroin in high school. He says his son was a star football player at Annalee High in Sebastopol and was an avid weightlifter.
People don't kind of realize that you can be really successful and still be an addict at the same time.
Micah said he bought Narcan to try to save his son if he ever overdosed. And at the time, the medication cost him $150 per box. Despite his best efforts, Micah Jr. died of a fentanyl overdose while at someone else's house.
And that's when we made it our mission to see if we could find a way to bring Narcan to people for free or a much more affordable price.
Micah and his wife, Michelle, founded Micah's Hugs, a nonprofit to help those struggling with addiction. So far, they've received 2 grants from the California Department of Healthcare Services of almost 4,000 boxes of Narcan to distribute to the community, to people like Michaela Sori, who lost her older brother to a fentanyl overdose in May.
It's happening so often that it could just be walking down the street and it's just a random person and then they might need help also.
I would love to see everybody carry Narcan, and there's nobody that really shouldn't be. Anybody can come across somebody that's having an overdose. It really is life-saving.
So when thinking about drug overdoses, some might think of a dark, seedy alley or street corner where all those drugs are exchanged in a quick handoff. In actuality, according to the U.S. Drug Enforcement Administration, nearly 50% of abused prescription drugs come from family and friends, including stealing from home medicine cabinets.
Opioids at home sitting around that may be expired or unused, those pose a risk to our loved ones, especially children, senior citizens, pets, and teenagers. It also increases the risk of theft in the home. So to remove those medications safely is very important.
The best way to protect your family is by disposing of your meds in a designated drop-off box. Ask your pharmacist where one of those is